Hey, friends. Welcome to Hormone Replacement for Dogs. I got on a little bit late because I was actually on a consult with someone from France, and we went a little bit overtime, so I apologize. But let's get into talking about sex hormones in dogs because this is new and interesting things and becoming more of a topic to talk about. And I just want to be clear that it's not an anti-spay or neuter situation. So, um, I'm not anti-spay and neuter. I'm not anti-shelter. I mean, spays and neuters have saved millions of dogs' lives by, not adding to the population problem. So there's a place for everything. And when we talk about hormones and lack of hormones, um, these issues don't happen to all dogs. It's very individual. So there are different options for different dogs depending on the dog, depending on the pet parent situation. There are all kinds of variables. There are variables about when you spay and neuter, how young, how old, if you do the kind of surgery that's done. There are so many variables that we just can't generalize and say this is what's best because we don't know what's best, especially how early we are in knowing what's going on with the hormones, because really in the last 10 or 20 years, we've started to know physiologically what's going on with the hormones. I mean, even in human medicine, they haven't figured it out. This was kind of an area that started to interest me and actually piqued my interest um, when I realized that me going through menopause and all the symptoms and the side effects and the things that happened to me when my hormones tanked were happening to dogs. I could kind of see it. So I could relate with these dogs. And now I see it more. So I'm more kind of hyper aware of the hormone situation. And so that's why I'm doing this. I want to talk more about it, start the conversation. Um, there's a lot we don't know. So, I'm going to kind of talk about what I do know and what the research shows, and I do everything I'm going to talk about has research behind it. Even how I'm doing hormone therapy in pets now. So there is research behind it. Um, I have gotten a lot of interesting comments on social media, and a lot of them not so nice. But that's okay. I mean, it gets people thinking, and we all have our opinions, and we just have to remember that there are so many different variables. Everything is going to be different for each individual dog. And I think that's one of the things is with the shelter medicine and spays and neuters, we were looking at a population problem. We were looking at this dog problem in the whole country, and that's how we fixed the overpopulation problem was with a community problem or community solution. Whereas now, you know, times are different. Our dogs are our children. A lot of people don't have children and their pets are their children. And so dogs have gone from property and in the backyard to at the table. And there are children. And so um we're also looking at more individualized medicine or individualized treatments for each individual pet. So it's a whole different perspective. We're not looking at a population problem of dogs. We're looking at the little individual Rambo or Darla or Nash. We're looking at our individual dog um, and making medical decisions on what we feel is best. Okay. So let's talk about, let's see. Um so when we talk about removing gonads. So the testicles are the ovaries and uterus. So you have your standard spay and neuter. The spay is where we remove the ovaries and the uterus, and the neuter is where we remove the testicles. And we thought that, you just remove the sex hormones, everything's fine. Um, but what we found out, and it's interesting how we found this out because um, vets like me that have been doing this for a while started noticing things, and we're like, why am I seeing so many cruciate ruptures? Like, what has changed in life that I see a cruciate rupture, every week in a dog? Or, when I started practice, 36 years ago, I rarely saw cancer where I see cancer every day in pets, and I'm helping people manage and treat that. So, and I'm not the only one, like, veterinarians as a group started to see these trends in all these different problems showing up more frequently, and we couldn't figure out why, like, we couldn't connect the dots. And then all of a sudden, there were some, reproductive veterinarians and theriogenologists, and research started coming out, and people were asking questions. Like, we were literally asking questions, like, "Why is this happening?" And, once we started delving into the hormone question, things started like, the lights started going on, like, "Oh my gosh, this is what's happening." And then the research started. So then they did research to look at all the past cases and what the history of the dog was, and, like, putting everything together and seeing trends. And then it's hard to do research, in the future, um, but we're working out the physiology now. So we're asking questions, we're connecting dots, and now I'm opening up the conversation so that we can talk about it. You know what? Before I go any further, I'm going to make sure that everything is cool on YouTube, because if it's not, I need to do something about it. So hopefully you guys see me. I just can't see your questions because I'm honestly not looking. So let me get that. Let's see. On YouTube. I'm so glad you guys are here though. This is awesome. All right. Let's go on live. All right. Says I'm live. Sorry, guys. There we go. All right. So it looks like I am live. Thank goodness, because I wouldn't want to be talking and not having anybody listen. I'm so glad you're with me. Okay. So let me get my video back here and see where I am. So once we started connecting the dots, um, and figuring out the physiology of what the hormones do and what happens in the body when we remove the hormones, um, things started making sense. And when we remove the gonads, when we spay and neuter a dog, we're not only preventing reproduction, but we're also changing the the messages within the body. Um, the Wi-Fi signal, like the pituitary gland is like this Wi-Fi, and it sends out information and to the different parts of the body, and it receives information and makes decisions. And and one of the big areas of research figured out that when we remove the actually, when dogs have the ovaries and testicles, the pituitary gland will tell those ovaries and testicles what to do and when to turn on and when to shut off. So the pituitary gland will release um, luteinizing hormone, which tells the ovaries that it's time to do what they need to do, or tells the testicles that they need to make more testosterone. So it tells the body what to do. And when you remove um, those organs, then the pituitary is still trying to tell those organs what to do. Like it still is trying to do its job, and there's no organ there. So you've got a pituitary gland producing this luteinizing hormone and basically yelling at the body to make testosterone, make estrogen, make progesterone. Like it's like, hello, hello, and there's nobody home because those organs aren't there anymore. And that might sound like, oh, well, so what? And that's kind of what we thought before. It was like, "Oh, well, so what?" So we don't have we just have LH in the system, and, you know, we didn't think anything of it, didn't think it was a problem. And then in a research study, they found that there are luteinizing hormone receptors not only in the ovaries and the uterus and the testicles, but there are luteinizing hormone receptors in the bones, the joints, the blood vessels, the brain. Like all over the body, there are luteinizing hormone receptors, which means when the pituitary gland is making all this luteinizing hormone, trying to yell at the ovaries and testicles that are not there, we've got this wave of hormones in the body, and they go other places. So since they don't have the sex organs, or the testicles and ovaries to go to, they go to these other places, and so they attach to the muscles, the blood vessels, the brain, the bones, the joints, the tendons. So they go to these other places, and they're not supposed to be doing that. They're not supposed to be pushing those buttons. The body was the body was meant to have the pituitary gland stimulate the sex organs, not stimulate the brain and the joints and the blood vessels and the muscles and all that. So it's pushing these buttons in all these different locations that was never meant to be pushed. And we're like, okay, so what? Well, it is a problem because when you have stimulation or inflammation being heightened in locations that were not supposed to have that happen, then you start to see problems with these organs that are being stimulated, and organs like muscle or joints or blood vessels. So we're starting to see problems in those other areas or other systems of the body that we didn't know was an issue. And that's where all these problems are coming from. 'Cause there's no feedback. There's no, ovaries or testicles to say, "Okay, stop, we've got enough. You don't need to make any more luteinizing hormone." There's no feedback loop anymore. So, um, the things that we see that have increased, so the things that have we've connected the dots, and the luteinizing hormone is stimulating these things that weren't supposed to be stimulated in the first place, at least to this extreme, are things like the tendons and the ligaments and the joints. So and these are all research based studies that have found this. So there are a lot of orthopedic issues that are increased because of these lack of hormones, or lack of sex hormones. Um, and what was I going to say? Oh, and it doesn't happen to all pets. And it also matters like when you spay and neuter. So there's so many variables. Not all dogs have this happen, and it varies on at what age they're spayed and neutered, and it also varies about all the other things you're exposed to: air pollution, what food you're feeding your dog, um, what toxins they're exposed to in their environment, whether you're using a lot of flea and tick products or you've got fragrance plugins in your house, which are toxic, um, what kind of water they're drinking. Are they drinking water with a lot of contaminants in it? Like, there are so many different variables. You just never know what dog this is going to happen to. And these issues that we're seeing, it's called spay neuter syndrome, where when you spay and neuter, these are the issues that start to have an increased risk of possibility because of the spay and neuter, but also because of other variables. So, and genetics are another variable because we actually see more of these problems in large breed dogs than small breed dogs. And that's a generalization because small breed dogs still can have this issue. Um, so, the orthopedic problems like the ACLs, the hip dysplasia, arthritis showing up sooner than you would think, like before they're old, elbow dysplasia, muscle atrophy or muscle loss or sarcopenia, um, and then increased risks of joint injuries when they're young and crazy. We see more injuries because the tendons are um, a place where they have a weakness because of the lack of the sex hormones. So, and another thing that we see is metabolism issues. And everyone knows that, you know, and veterinarians have always told you that when you spay and neuter a dog, you need to decrease the amount you're feeding because they don't need as much because their metabolism slows. Well, we didn't realize the bigger ramifications of that and why that happens. And um, Never mind. I was gonna say a lot of the people have said, "Well, you did know, and why didn't you know?" And I'm like, "You know what? 30, 40 years ago when I came out of school, this is what, I was taught certain things and I thought it was gospel. And now I'm figuring out that a lot of the stuff I was taught was not right and medicine changes. So I'm changing with it. And yes, I didn't know things back then, and neither did any other vets. So now we know more about why we recommend, changes in feeding to prevent obesity when we spay and neuter. Now we know that the spay and neuter actually causes a change in the metabolism that leads to obesity and leads to, you know, um, insulin resistance and thyroid problems. Like, we're figuring this out. So we didn't always know this. Um, Behavior problems are actually more common in spayed and neuter dogs. So we're seeing more anxiety, more noise phobias, more fear aggression and fear-based behaviors in spayed and neutered dogs that just don't seem to make sense. Um, Training used to be easy. And now we're finding that we have these behaviors that are just kind of off the wall. And that's because that excess luteinizing hormone is affecting the adrenal glands and, the pituitary and all these other areas of the body that we never considered. And so, you know, we used to think that spaying and neutering would reduce aggression. Well, that's usually not the case. It's usually the opposite. So you actually see um, more aggression or more chance for aggression in your spayed and neutered dogs. So, what we thought before is now disproved by what we're seeing in general and now with research. The scary thing is, we're seeing these links with cancers, and cancer is a factorial condition. There are a lot of different causes of cancer, and it's all kind of all these things together that will result in cancer. If we knew the exact cause of cancer, we'd have a cure, right? But there are just so many variables like the food, the water, the toxins in the environment, genetics, and then the epigenetics, like what you're feeding your dog. But the excess luteinizing hormone is one of these variables. And so we're seeing this shift in cancers. And that's one of the things that vets have noticed over the past several decades, including me, is why am I diagnosing hemangiosarcoma, osteosarcoma, lymphosarcoma, mast cell tumors. Like, why am I diagnosing these so frequently where I wasn't before? Like, literally wasn't hardly at all. And that has to do with what we're seeing with these shifts with the hormones. So when we remove the testicles and the ovaries and the uterus, and we don't shut down that feedback loop from the pituitary gland, then the relative risk of cancer will go up because that luteinizing hormone is sending signals to organs it shouldn't. And like with hemangiosarcoma, it's sending signals to the blood vessels because hemangiosarcoma is a blood vessel tumor. We're also seeing more transitional cell carcinomas, which are bladder tumors and prostate tumors, um, and more prostate carcinomas in our neutered males based on our neutered males compared to our intact males. And granted, your intact males can have prostate cancer too, but we're seeing it more in the neutered males. Um, so, and there's research behind this. So, and if you want the research, I'll put links to the research in the comments below the video. Um, because everything I'm saying has research behind it. I'm not making this up. Um, Contrary to what social media people think. I have educated myself, and I'd love to educate you and let you know about what's going on and what we're finding and the solutions. Okay. The other thing that we're seeing is more autoimmune problems, and thyroid problems is actually an autoimmune problem um, a lot of the times. So you have inflammation of the thyroid gland that then causes it not to work and kind of scar down and result in hypothyroidism. We're seeing more immune mediated hemolytic anemia, thrombocytopenia. We're seeing more allergies. How many of you have dogs with allergies? Like, that's another huge topic. So we're finding that that's related to these hormone issues. And so is like IBD, which is another huge thing that gets diagnosed all the time now when nobody, when I started practicing, none of the specialists ever said anything about IBD. And I'm like, what the heck? And I get calls every day on it now. So autoimmune problems. Um, Incontinence is a common one. So your spayed female dogs have more problems with incontinence because they lack estrogen. So we have the estrogen related or estrogen responsive incontinence. And that's what my dog had, has had. I have her on hormones, so I'll talk to you about that. All these things are part of the spay neuter syndrome. Some dogs have none of them. Some dogs have a lot of them. Um, but it really makes you think. It makes you think that maybe we can prevent this. Maybe we can do things to help prevent a dog and modulate their risk to cancer or ACL or autoimmune problems. Instead of being reactive and wanting to treat it, with hormone therapy once they get it, we have to kind of shift and think, how can we prevent these problems with now the information that we know? So now that we know we've got this feedback loop with the luteinizing hormone that won't stop, like what can we do to do something about that and prevent these elevated risks in our dogs? There are things, right? All right. So the procedures, got a lot of comments on this. So there are actually procedures. Like if you get a new puppy and they're not spayed or neutered yet, and you have an option on, if to do the surgery at all, or if to do or doing an alternative type of surgery. So you have options. The alternative surgeries that are the most popular and the most rational out there are one vasectomy in the boys, where we just um, cut the tubes, but leave the testicles. So they still have their hormones and they still have their testicles, but they cannot reproduce. And then with the females, the ovary sparing spay is an alternative surgery which will prevent pregnancy, prevent pyometra, which is a big concern. Everyone's like, "What about pyometra?" Um, if you do an ovary sparing spay, that means that we leave the ovaries, but we remove the uterus. And pyometra is a uterine infection. So if the uterus is gone, you can't get a uterine infection. So it eliminates the possibility of pyometra and reproduction or having puppies. And it keeps the hormones. So it modulates those risks of other diseases, which is great. And then I had people be like, well, what about stump pyometra? And I'm like, dear God, okay, people, let's get into the weeds. So, stump pyometra is an infection of a little piece of the uterus that was accidentally left at surgery. So, when the surgery is not performed 100% correctly and they clamp off, um, you're supposed to clamp off at at the cervix. And if they clamp off a little bit higher than the cervix and leave a little bit of uterine tissue there, dogs can get a uterine stump pyometra. So that's a risk because you don't know, you have no idea, if the surgery was done correctly, and probably the surgeon that did it has no idea if they did it correctly. Being a surgeon, we get in there and we can find the cervix, and it's you just do the best you can on transecting it in the right location. I think the situation occurs where, you know, vets that do high volume spays and neuters, they're doing spays in 5 minutes, like, literally, they're, like, in and out, boom, 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 boom. Like, they get fast, and, um, you can leave a piece of uterine tissue in there. That's totally possible, and then a stump pyometra can occur. That's a risk with any dog, whether they have a regular spay or an ovary sparing spay. So that's still a risk in your spayed dogs. So that makes no difference. All right, I'll try to go over all the nasty comments that I got on um, social media because there were a lot of them. But the good news is it opens up the conversation and it gets people thinking, even if they're not thinking that maybe they're not thinking I'm a real vet, um, or they're thinking I'm stupid. But whatever. So it actually opened up the conversation, and maybe down the line, someone else will say something and it'll click. Yeah. Okay. So we have the alternative surgeries that, if your dog is not already spayed or neutered, that you can ask about, and your vet may do them, or there are more and more vets performing these surgeries and not just your specialty surgeons. If you go on the website, parsimus.org, they have a list of veterinarians that do the alternative surgeries like the vasectomies and the ovary sparing spays, and they list it by city and state so you can find someone close to you. So more and more people are doing those, and it just takes a different technique. It's not any more difficult than a regular spay or neuter. It's just a different technique that it's going to take a while to get vets to um, change their ways. And that's another issue, like with shelter medicine. I mean, it's like this little island over there with shelter medicine doing their own thing, and it's going to be a while before they change their ways and think about doing these alternative surgeries because they're high volume and population control. They're still in that um, way of thinking. But in the future, this may be something that is done routinely, even in shelter situations where people have options, or they just do that in shelters. Who knows? Who knows? So we just want what's best for our pets. I mean, that's the bottom line. What's best for our pets, And sometimes this is what's best, the alternative surgery is what's best, or not spaying and neutering at all is what's best. It just depends, and it depends on what you're willing to put up with. Another thing that is interesting is with the alternative surgeries, the females will go into heat because they have their hormones, they have their ovaries. So their vulva will swell. They'll have the behavioral changes that they have with going through heat, but they don't bleed because they don't have a uterus, and the uterine lining is what bleeds. So since they don't have a uterus, they don't bleed, but they still go into heat and they attract the males. And one of the things was like people were worried about, them getting bred. Um, and so far there are there's no evidence that um, a dog with an ovary sparing spay being bred is any more traumatized than a intact dog being bred. Okay. So, or a spayed dog. Um, so we haven't seen any increased problem with that. And then, we're assuming that people that choose these surgeries are not going to put their dog in this situation to get bred. But things can happen. I know. I realize things can happen. But we haven't seen any evidence where there was a problem if a dog with an ovary sparing spay gets bred, that they're hurt in any way. Okay. So, what if your dog is already spayed and neutered? They maybe came from a shelter, or um, it was the right thing to do at the time. Um, Veterinarians were taught that that was the right thing to do, spaying and neutering everything. Um, so a lot of us have to change the way we think too. And um, if you have a spayed and neutered dog already, like what do you do now? Like how can you stop this pituitary gland from releasing all this luteinizing hormone that's going all these other places and increasing the risk of um, inflammatory problems in all kinds of different organs, whether it's tendons or bones or blood vessels or brain or whatever. Um, so with um, let's start with something that we'd use for both male and female dogs. So there's actually an implant plant called suprelorin. And suprelorin is a gonadotropin releasing hormone agonist that tells the pituitary gland to stop yelling at the organs, like stop with the sending all that luteinizing hormone all over the place. Just stop. So it's actually an implant that you inject in the dog, kind of like a microchip placement. It's got a big needle, and you inject it into the dog, and it is um, a medication that blocks those pituitary hormones from causing all that excess luteinizing hormone all over the body. And so that's appropriate in both your spayed females and your neutered males to stop that LH. So that's something that can be done in both of them. Now, an implant is not forever. It's not like a microchip that lasts forever. It's more like a hormone implant in women where it lasts maybe 6 months. We don't, we think it lasts about 6 months. We're still working on all this, and this is relatively new information. Although the suprelorin is not licensed for use in the United States for dogs, but in Canada it is. So in Canada they have a dog product for this very issue. Go figure. We don't, but we have a ferret suprelorin. Um, so um, so what vets are doing is they're using the ferret implant off label or extra label in dogs that are spayed and neutered. Hopefully, we can get the company to license the dog product here too. So there's no reason why they shouldn't, but that's That's how it is right now. So that's something that hopefully is in the future. But the suprelorin implant, is the first thing that we think of to stop that pituitary gland from yelling at the organs, and sending out all this luteinizing hormone willy-nilly everywhere and increasing all these, the risk of all these other issues in the body that we didn't know about before. Doesn't happen in all dogs, may never happen in your dog, but if it does, now you kinda know what to look for. Is your dog acting arthritic before he really is old, or if he's got cognitive issues, or if he's got anxiety and fear aggression, or if he's had ligament tears that you're like, "What the heck?" Like, people sometimes start to put things together with their own dogs, and they're like, "This doesn't make sense that my dog has cancer when they're 5 years old." It's like, so we're starting people are starting to notice that their dogs are just not themselves, when they're spayed and neutered. And so this is something that should come to mind. And there are actually, um, so the list of veterinarians on parsimus.org website, there are veterinarians that offer the hormone supplementation also. So they do have a list of hormones. They do have a list of veterinarians, that are practicing hormone replacement for dogs. And I have a veterinarian here in Phoenix that does. So, and she has prescribed, the hormones for my dogs. Uh, so if you're in Phoenix, let me know and I'll hook you up with her. So suprelorin is the first thing and can be used in both male and female spayed and neutered dogs. Okay. Let's go over the neutered boys first because they're easier. In fact, um, as far as hormones are concerned, human men are a lot easier than human women as far as their hormones because I don't even think they've figured out women's hormones yet. That's actually a developing, area too, which I'm exploring, and there are a lot of different options for women in menopause. Let me tell you. But for the neutered males, the other thing that you can do, and sometimes the only thing people will do is they will supplement testosterone. And it's actually a in dogs right now, we're doing testosterone injections. So testosterone cypionate injections. And it used to be just intramuscular, like in the muscle, but now, um, a lot of vets have more experience with this and they're doing it subcutaneous, kind of like how you give a vaccine under the skin. And they're finding it works just as well subcutaneous. So we're doing subcutaneous injections of testosterone cypionate in neutered males to, give them their hormones back. And some people do that without the suprelorin. Others do both the suprelorin and the testosterone. So, it depends on the individual. This is all very individualized medicine, which is where veterinary medicine is going. It's going to more an individualized patient, which is great, because every dog is going to be different and have different needs. And what works in one may not work in another. And we're still really figuring this out. This is all, very new information, and even the dosing is new. Um, so I actually started the testosterone cypionate on, my really old dog that was having a lot of trouble walking and muscle atrophy, and I actually started him on it to build up his muscles, and it did a whole lot more than that. Like, it built up his muscles and gave him more stamina, but also gave him a lot more energy and a lot more interest in life, and it was pretty amazing, how just a testosterone injection improved his quality of life. So I was, like, totally sold when I saw it in my own dog. So that's Rambo. Rambo's doing amazing. Um, so he gets testosterone injections, and usually we'll do that weekly. And you can do it monthly. And so I kind of played around with that to see what the difference was. and I really prefer the weekly, so I would recommend a weekly injection versus the monthly, because the monthly injection, when you inject the testosterone, you get this high level of testosterone, and then it kind of, tapers off over time and goes down, and then you give another one. Whereas if you do it on a weekly basis, it doesn't have the high and low like the monthly does. And honestly, the the high testosterone, I had a bunch of horn dogs in my house, so they were interested in each other. Um, and most of them are old, so it was pretty humorous. So I really liked the weekly, and I didn't see that high spike in testosterone and the goofy behaviors that ensued in my household. So testosterone weekly. And that's it with the boys. So the supralerin implant and the testosterone, and sometimes just the testosterone. It depends on what we're working on in the dog, or maybe what they need. Some of them don't need one or the other. So it just depends. Uh, we don't have any protocols for this yet. But with all the interest, that veterinarians are showing, and we do have a site for veterinarians. Dr. Karen Becker and Dr. Tobias have a site for veterinarians to find out more and learn about um, uh, how to proceed with doing this for their patients. So if you're interested in that, let me know. In fact, I'll probably just put the link below this video for you. Now for the girls are a little bit more challenging. So I have a spayed female dog that I got from a foster home, and they had her spayed really early, 8 or 10 weeks. So she was spayed very early before I got her, unfortunately. But that's all right. That gave me the opportunity to learn about this because um, she developed incontinence. She's only 14 months old now, and she developed a urinary incontinence before she was a year of age, and that's because of the lack of estrogen. So I was like, "Well, this is perfect. I'm gonna figure this out." So I gave her the supralerin injection or the implant, and sometimes that's all that the girls need. But some of them need more. And so another protocol for the girls is to do supralerin implant testosterone injections, just like the boys, because girls do have testosterone. Even women have testosterone. Um, and then estradiol. And a lot of dogs are already on estradiol. If you have a dog with urinary incontinence, the estrogen responsive urinary incontinence, they're likely on estrogen already. So um, oh my gosh, what is it called? I can't remember the brand name. I'll remember it. But a lot of dogs are already on estrogen for the urinary incontinence. It's not the phenylpropanylamine. That's a different thing. Incurin. Incurin. That's the estrogen replacement for incontinence. So a lot of dogs are already on the estrogen. But they also need to have that LH blocked a lot of the times, and maybe even a little testosterone. And so there is a protocol that veterinarians are using now for that combination of the supralerin implant, the estradiol pills, and the testosterone injection for the spayed female dogs to help with hormones. So it helps replace the hormones that were lost by the spay procedure, and also block that luteinizing hormone from the pituitary gland that's affecting all these other organs. Okay, so that's what we're doing in the girls. And I actually, when I started my dog Darla on this protocol, both of my dogs that I'd started them on, I actually saw results the next day. It was crazy. I couldn't believe that it would happen so quickly. Um, but Darla went from, needing to be lifted into the truck to go to the dog park to like launching herself into the truck the next morning. And I was like, holy cow. Um, so she's shown some changes in um, The incontinence went away, the strength, um, improved, her strength improved. Um, she's still a crazy dog, but I would say that, um, she's actually not as crazy and more engaged with people, and she's really a lovey-dovey dog. So, it's really cool, to see the changes. Alright, so, um, what about if you're kind of scared of, all these hormone things, or you don't have access to veterinarians that are prescribing hormones, and maybe you're unsure of it, like, there are things that you can do that are natural, and there is some research on it. Some of it we are kind of making assumptions, and there is research going on about some of these natural, um, hormone replacement, products. But basically, and you can do the natural stuff along with the hormone therapy, the synthetic stuff. So you can do both of them, because who knows? I mean, this is all new, but it's actually safe to do the natural with the synthetic hormones. And so the natural protocol is, um, CBD. They have found that the cannabidiol will, or they this is the hypothesis that's being researched right now. The cannabidiol molecule will bind to the luteinizing hormone receptor sites in the body and be that feedback loop to the pituitary gland that says, "Okay, we're fine. You don't need to keep shooting out luteinizing hormone." So what the hypothesis is that the CBD blocks those receptor sites of luteinizing hormone so that the pituitary gland shuts off and doesn't cause that surge of luteinizing hormone 24/7 that's causing these chronic diseases in the future. Um, that's um, that's something that's being worked out right now. But certainly, what I think about CBD is it certainly can't hurt, and it can help a lot of other things too. Um, so, like when hormones are removed, like when I went through menopause and developed joint pain, muscle pain, um, brain fog, anxiety, like CBD helps with all of those things too, right? So certainly can't hurt, and that's how I look at it. There are 3 things we use. So CBD, glandulars. So glandulars are, um, desiccated or freeze-dried glands, or organs like the ovaries, the testicles, the pituitary, the hypothalamus, the adrenal gland, like all the organs from, you know, the meat that they're eating. So, like, if you feed a beef food, like, all the different parts of that cow need to go somewhere. So, they harvest all the organs and they go into these supplements. And so you're giving your dog a supplement, and there are either glandular products that have everything in them, or there are glandular products that just have, like, the boy stuff in there with the testicles and adrenal gland and pituitary, and the girls would have, like, the ovaries and the adrenal glands and the pituitary. So there are all different kind of glandular products out there, and I think, Dr. Karen Becker is working on, her brand, which I highly recommend when it comes out. But glandulars give the body the the energy of that organ that they're missing. And at some level, the body is probably like, "Okay, well, I have this organ in here somewhere," because you're feeding them the ovary or the testicle in this supplement, this either a pill or a powder, um, which can help the body, um, see that maybe the organ is still there. So glandulars are very helpful. They're also very nutritional, honestly. Um, And then the third thing is, medicinal mushrooms, especially things like reishi. Reishi is the mushroom of vitality. So mushroom supplements are wonderful, not because they block anything, but because they are immune modulating. And a lot of these issues that we see with dogs that are spayed and neutered with this spay neuter syndrome are um, inflammatory, and some of them are a hyperstimulated state, like your autoimmune problems and your allergies, and some are a suppressed immune suppression state, like your cancer. So it could go either way. And what mushrooms do is they modulate the immune system. They take the part of the immune system that's overactive and hyperactive, and they pull it down to a normal position where it should be, and it takes the suppressed part of the immune system and it brings it up and nourishes it and brings it to where it should be. So they modulate the immune system. So they're wonderful supplements in general, really for anybody. But when we think about what's happening in spayed and neutered dogs with the spay neuter syndrome, it just makes sense to add an immune modulatory supplement. So mushrooms. So we do mushrooms, glandulars, and CBD. And I actually have, let me see if I didn't even look on here before I started because I was in such a hurry to jump on because I was doing consults all morning. Um, Let me put on Parsimus. There's Parsimus Foundation. That's where, let's see. That's where you can get the information on, let's see, on veterinarians that do the alternative spays and neuters, and when they and the ones that are doing hormone supplementation. So that's the Parsimus Foundation. If you just scan that QR code, it'll take you to the Parsimus. All right, let me look at some of my other ones. QR codes. Let me see if I have my bundle in here. I actually have a bundle of supplements for our spayed and neutered dogs. Nope. I don't see it. So what I'll do is I'll put a link to the supplement bundle that is basically over the counter. And let me pull that off. And I have a bundle that you can get with a mushroom supplement, a CBD or hemp supplement, and the glandular supplement for either the boys or the girl. Okay. So so those are the things that we're doing with hormone supplementation. And there's a lot we don't know. This is a new area, a new-ish area. There's a lot of controversy. I get that. Um, but it's something to think about, especially if you're noticing that your dog just isn't right. If your dog is spayed and neutered and they're just not right, and the cognitive decline in old age um, can be related to the hormone loss because they age faster. So this is a valid thing to explore, and really I think it's a nice area to work on prevention. And prevention can be alternative spays and neuters instead of just your standard spay and neuter, or adding supplementation when you know that they don't have those hormones anymore, to like actual hormone replacement therapy. And it depends on how you feel about it, and if your dog is showing symptoms, or if you just want to prevent problems. Um, there is lab work out there. It's not standardized yet, as far as I know, but there's lab work like for LH and testosterone and estrogen and all that. But we're still trying to figure out, what they should be. And I think Colorado State is doing some studies right now on it, and veterinarians are sending in their samples of blood on their patients for hormone testing so they can figure things out. So it's a big area. It's being worked on now. There will be more information in the future. There is a website called Hormone Health for Dogs.org. And that's a site if you're interested in learning more about that. Um, so thank you for being here with me and listening. And I see a lot of people. Let me see if anyone asks any questions. I see a lot of people saying, hello, hello, this is so important. Thank you. Average cost for the injection. I'm assuming the Suprelorin injection. I have no idea, because um, I don't know what they're charging for the Suprelorin, or well, I know what they're charging for the testosterone because the testosterone we get from I got it from CVS Pharmacy, and it can be quite expensive, but all the dudes are on it. So the dudes with low testosterone are on the testosterone injections, and it can be hard to get. In fact, even the women's hormones are super hard to get because there's such a demand for it right now. But the testosterone cypionate, um, I think it costs me. You have to use good RX, otherwise it's insanely expensive. But I think it costs me like $125 for 3 months. So so there is a cost involved, and that may be a consideration. I do not know what the Suprelorin costs because the implants are quite expensive, and so you have to have someone actually put the implant in, and the dog does not have to be sedated or anything. It's just like putting a imp microchip in, um, but they are sort of expensive. But I don't know what the vets are charging for them right now. But that was the testosterone, and then, like, estradiol, which is the Incurin in females, whatever your vet charges for that, I'm sure. Um, I don't know what they charge for that either because I don't buy it from a vet. Um, but there is expense, so it's not something that is cheap, but it's something that will prevent expensive problems. So, and prevent and potentially prevent expensive problems and potentially prevent um, life-threatening problems. And that's what we all want for our dogs, right? We want to prevent bad things from happening to them. If there's something we can do to help them that we now know about, why not? When I was in school, we learned how to declaw cats, do ear crops, do tail docks. It was all standard of care, right thing to do. And now I would never do that. So we just all want what's best for our pets, and it changes over time based on what we know. We know more about particular things that there are ramifications of things. So we know more and we can do better now. So when we know more, we do better. And that's what we're doing. And if you have more questions, I have a bunch of stuff on my Substack on this subject, and I'll probably put more out there. Um, this is my Substack. If you want to scan the QR code, I have a couple articles on hormone therapy, as well as spay neuter alternatives and more stuff. Okay. All right. So thanks for being here. And I will see you again. I'm not sure I'll do a live next week because I'm actually headed to a conference that Dr. Steve Marsden is putting on in Australia. Maybe not. Um, I might do a a live from Australia, but the time is kind of wonky, so I'm not sure what kind of situation I'm going to be in, but I'll know more next weekend. All right, everyone.